Well, the first step is an easy one, the opposite of what Prentice and the government is doing. Local decision making. The centralization after centralization is causing rationing, is causing huge cost increases. 20 years ago, health services was $4 billion. 10 years ago was $8. Now the combined Alberta Health Services and Alberta Health is in the $19 billion vicinity. This doubles again in the next 10 years. Crowd out all the future spending or crowd out the next generation. I, for one, want to leave the campground in better shape than I found it in. And so local decision making where people have autonomy and real control is the first step. The second step is to reduce layers and layers of bureaucracy, not frontline workers. We might even go back to hospital boards in some cases if that what looks like it's the best way to do it.
A total revamp of the system as far as its focus on healthcare. As I mentioned before, I think they're too caught up on process and not enough on actually healing the patient. And I think that we need to refocus the energy from management and paperwork to frontline workers and healing. When you start cutting tests to find out what people are sick with, when you start cutting budgets for that, I think the whole system's in trouble because it works. You have to treat people, of course, to heal them, but you have to have the focus of healing, and that's just missing. So I think there is a lot of fat in Alberta Healthcare Services. We also have to get rid of March Madness, where often departments spend 20% of their budget in the last month of the fiscal year in March, and I don't think that's a reasonable way to congratulate somebody on a job well done when they have to spend 20% of their budget just so they have it for the next year.
I guess the biggest reform for Alberta Health Services and healthcare is taking a look at their top bureaucratic management. The present Alberta Health Services structure has removed the frontline workers' input into possible solutions. Frontline workers are again now being told that they're going to have to cut back, and so. How do you maintain and sustain a long-term healthcare system when you're every 5 to 10 years you're cutting back and then you're saying you don't have staff and you have to be going back and forth?